I'm here on the Mummy Pages sofa with Dr Ciara Kelly, GP and broadcaster, to talk about the common issue of incontinence in women. Welcome.
Thank you, Laura.
So this is actually quite a common issue, but it's not talked about amongst women.
Yeah, and I think that's very unfortunate. There's a recent survey and it showed that 54% of Irish women were suffering with this, and that half of them have never sought any medical intervention or any medical advice about it. So half of the women who have this problem, and that's half of all women, aren't doing anything about it. They're literally just putting up with it and thinking that it's normal. It does have social implications, because I think when you talk to women about it, they say, you know, that they avoid going certain places, that they wear dark clothes, that they plan their day around where there's a loo and all that kind of stuff. So they're actually limiting themselves because of it. And there is stuff that can be done, and I think that's the key thing. They're not looking for the help, but the help is there. So what we're trying to do is reach out to women and say it's really common. And one of the key myths is this, is it's not just older women, it's women in their 20s, 30s, 40s, 50s.
So what actually causes it? Because we've had some questions in from our Mummy Pages mums. We've had everything from medication they might be taking, blood pressure tablets, to is it hormonal, the time of the month. We've had women who've had vaginal births, women who've had cesarean births, and then women who are just saying, gosh, is it not just part of the ageing process? Should we not put up with it?
First of all, the answer to that last question is no, don't put up with it. You deserve better, and there is help out there, and I think that's very, very important. The general cause of stress incontinence, and that's the incontinence where if you cough or you sneeze or you're on the dance floor or you're running or you jump up and down quickly, that you wet yourself. The general cause of that is a weakness in your pelvic floor. And your pelvic floor is this sort of sling of muscles that is at the bottom of your pelvis that keeps everything inside. And a weakness there is what causes the leaks, okay? And how do we fix that? The main thing is just to strengthen your pelvic floor. Now, it's quite hard to do pelvic floor exercises. A lot of people know how to do them. It's where you kind of clench everything. I couldn't really explain it to you right now, but it's how you kind of clench everything. And a lot of people do them, but that's very ineffective, to be honest, because it's a very difficult thing to do. So there are other things you can do. There are physiotherapists you can go to who will help you with this. And there are neuromuscular stimulants, which are things that you wear. Now, the old school ones were internal and considered really unacceptable. I think a lot of women didn't like them. But there are new garment-based ones, and actually there's one that there's a company in Galway doing, and you literally wear it, you literally wrap this thing around you, there's nothing internal, and you put it on and it passes currents across your pelvic floor, which stimulate it and strengthen it. And it's been shown to work, and you use one of these products for about 8 weeks and your pelvic floor strengthens, and then there is a lasting benefit to you afterwards. People talk about, I think, the stigma of mental health issues, and you can't talk about those. But I actually think this is the last great taboo. Women are very private about this, really don't want to talk about it, and I think it's an awful shame that they don't realise just how extensive the problem is. You know, in other countries, for example, France, it is normal that after you give birth for 10 weeks, provided by the state, there is physio weekly and neuromuscular stimulation weekly, so that French women don't have these issues. Irish women are just putting up with it. We deserve better.
So then, in terms of other issues that could be causes of it, some of our Mummy Pages mums mentioned the time of the month. Is that something?
What can happen is, as you approach your period and the lining of the uterus thickens, so your uterus becomes heavier and more bulky before you get your period or before you're about to become pregnant. So the uterus gets bigger and heavier and fuller, and that then puts pressure on your pelvic floor because it is a larger organ and a heavier organ than it is after your period. So yes, that can be sort of something that can affect it. People who drink a lot of fluids during the day, they say they have a bigger issue. Some women who are on, I know Mummy Pages came on and said about blood pressure medications.
That's it.
They're on tablets called diuretics, which cause them to wee a little bit more often. That makes the problem worse. Those tablets can be adjusted. Go in and ask. The problem is women aren't talking about this.
And one of our Mummy Pages mums said that she's had 4 cesarean sections. She hasn't had a vaginal birth. And so how could she have weak pelvic floor muscles?
Well, for 2 reasons. One is she may have an innate weak pelvic floor, but bear in mind, if you're pregnant, if you're carrying a pregnancy, even if you haven't delivered, you've had that huge weight sitting here, sitting on your pelvic floor, stretching it. So, you know, sitting there in the sling that is your pelvic floor, and that weakens it too, you know. And age weakens all our muscles, and you know yourself, if you don't use it, you lose it. So if you're out walking or whatever, you strengthen your leg muscles, but how do you stimulate the muscles in your pelvic floor? It's quite hard to do.
Well, thank you so much for all the advice today. And so really the bottom line, ladies, is go to your GP, get the advice. There's some really easy to use help available there for you. We've got that really nice garment, you can wear it, you don't have to use the internal probes, and get those pelvic floor muscles working again for you.